Good evening, everyone. My name is Sharon Moreno, and I'm a family nurse practitioner. I serve the great state of Texas via telemedicine, and I see patients physically in the Rio Grande Valley. We have a special guest today, Felicia Casas, and she's with Legacy. And I'd like for her to introduce herself. Felicia, introduce yourself.
Hi, I'm Felicia Casas. I'm community relations with Legacy Home Health. Legacy has been servicing our community for over 30 years. Our mission at Legacy is putting people first by delivering quality, compassionate care. So, if you are interested in provider services, Legacy Home Health is an agency that can assist with those services. Our phone number is 956-467-5668. You can reach out to us and we'd be happy to assist in guiding you with those services.
Absolutely. Guys, we are Gold Rush House Solutions, and this segment is on provider services. And as I mentioned, we have a special guest, Felicia Casas, and today we have Legacy, and this is who we're speaking with. And another thing, I know she's mentioned the services that are being provided, but they actually are hiring providers. So if you're looking for a job, we're going to be discussing pay and what it takes to be a provider with them. So stay tuned. Also, want to mention, as always, we'll put up our legal disclaimer. In the meantime, we get started on our topic. That if you have topics that you're interested in us discussing, please mention those, post those, say hi, and let us know what you're interested in. If you have a small business and your medical having to do with medicine, then and you'd like to be a spokesperson on our show and provide great information to the public, I'd love to have you. Definitely send me a message or a text. Text through. Let me put my information up. Actually, like I said, we are Gold Rush Health Solutions. You can contact me via text message 956-640-6963, or you can send me a message through Facebook Messenger under Sharon Moreno. I offer a variety of services: weight loss, vitamin B12, steroid joint injections, antibiotic, prescriptions, basically, you name it, and we do it. All right, so let's get back to provider services. This is a really important topic because this is something that can help the community a whole bunch. My mother actually has a provider and she's with Legacy. So I trust Legacy a whole bunch. I refer to them, essentially all the patients that need provider services. So I have them on because I trust them dearly with the patients that I feel benefit from our services. So, Felicia, let's say I'm a patient and I feel like, you know what? Maybe I'm interested in provider services. I have some doubts. What can I do? What do I need? Let's say insurance wise. Can I have regular insurance? Do I need Medicare? Do I need Medicaid? What kind of insurances or benefits do I need in order to qualify for provider services? Let's start there.
Okay, so provider services are considered your long-term services, which falls under Medicaid. So Medicaid is what covers those services. It would not be private insurance. We do offer private pay, but Medicaid is what would cover those services. Mhm.
Okay. Well, let's say I don't have Medicaid. Does that mean that I'm excluded from provider services? How can you help me if I don't have Medicaid? And I think I qualify or I'd like provider services.
Mhm. Absolutely. So if you do not have Medicaid, you're not sure if you can qualify, we do have staff members that can assist with that application and guidance to applying for Medicaid to get you started. So, it's a simple phone call. Again, the phone number is 956-467-5668. And our staff is very knowledgeable in Medicaid and the application process. So give us a call and we can assist if you don't have Medicaid. Now, if you did have Medicaid and you had eligibility loss, we can also assist with getting those services back or that coverage back, if you will.
So what I'm hearing essentially is whether there's any doubts, whether you don't have Medicaid, excuse me, or you had it in the past and not sure if you had it in the past and don't have it currently, then the reality is what people should be doing is really contacting an agency like yours uh,
Hmm.
for guidance, because at this
Right.
point then you guys have knowledgeable staff that can guide you through the process. And I will say, in the case of my mother, she did not have Medicaid, and she contacted Legacy, and they helped her. They did all the paperwork for her, which I'm not gonna lie, it's a pain in the bottom. It's not
Hmm.
exciting, but they took care of all that for her. And so they really were extremely helpful and communicated with her during this whole process, which is what, elderly and ill people need, is for someone to really just take the bull by the horns and assist them with that lengthy process, because the typical lay person, and even us some medical people, don't completely know these processes, because there's so many different processes that are required to get different programs. And so
Hmm.
that's why each program is the specialist in their particular discipline to help guide people get what they need. So it sounds like that if there's a doubt and you may be interested in provider services, that you should call someone who specializes in provider services like Legacy, and they would be able to help guide you through that process and say, yes, let's get you in, let's help you. And you're in, you qualify, or no, you don't qualify at this time. But just because you don't qualify at this time doesn't mean that ultimately you may never qualify. You may wait a few months, then try again. Is that correct, Felicia?
Right. Yeah. So there have been cases where we have had clients get denied. It could be missing information, it could be all sorts of reasons, but we do take the time to assist and really dig into that and help them, get those services back or get qualified for the Medicaid, which would they would need to be covered for the services. So,
With the provider
um,
services.
mhm, yes.
Okay. So let's say that I'm thinking I may qualify. What kind of diagnosis or what kind of symptoms would qualify me to get provider services?
So provider services, now we assist with the provider services for adults, which are your POS services, your personal
Yes.
attendant services. And we also have PCS services as well. That would be your personal care services for children. So it is a similar process, similar diagnosis limitations, and that would range from people with disabilities such as chronic illnesses or mobility issues. It ranges, but those qualifications would possibly qualify the patient for services, whether child or adult, also with intellectual disabilities as well.
Sure. So things I've seen more
Mhm.
commonly are things with like dexterity, where they have issues, handling things, issues with movement. They have dizziness. They have weakness to lower extremities. They have difficulty with vision, difficulty
Mhm.
hearing. They have some confusion. Basically, difficulties. What we know is ADLs, or activities of daily living. Things like
Mhm.
brushing their teeth, brushing their hair, taking a shower, having meals cooked, feeding themselves. Am I correct?
Yes, absolutely. So those would be the daily living activities, and those would be, as you listed, the feeding, grooming, bathing, laundry, cleaning. We do have escort as well. Now, when we say escort, that is not the attendant can drive and take the client or patient wherever. It is more so the attendant escorts the client or patient to do their errands, such as their shopping. But it is not to for the attendant to be the one to drive them anywhere. So we do have that task as well if they qualify for it.
I understand. Sure. Okay. Well, that makes complete sense. All right. Well, let's talk a little bit about the hiring that you're looking for. So it looks like that you guys currently are hiring providers. Can you tell us what that would look like? You know, if I was interested in being a provider, what would my pay look like? What would hours look like? What would schedules look like? What kind of task would I be looking to complete as a provider?
Yes, so right now, Legacy Home Health has a pay rate of $13, but we have exciting news. We will be having a pay rate increase coming soon. That announcement will be announced very soon. Um, but as far as hours, those type of things, it really ranges. If a client if a I'm sorry, if a attendant is looking for maybe Monday through Friday or something on the weekends, in the mornings only, in the afternoons, in the late evening. It just depends on what their schedule is and what they're looking for, that we can match with the clients that we have and we can pair them.
That makes complete sense. Obviously, it has to
Mhm.
do with when the patient has more necessity. You know, it may be morning hours, it may be evening hours, or maybe split hours, right?
Right. Yes. And then also as well, we do have some patients who have mobility issues. So if they are in a wheelchair, if they are bedbound, or ambulatory, which is they're able to walk. It just depends on what the attendant is looking for. And then we can go based off of that and match the client with the attendant.
Absolutely. All right. So I think the takeaway here definitely is if there's a question of do I qualify for services? Do I qualify for service as in do I have appropriate diagnosis? Do I have appropriate symptoms? Do I have appropriate coverage? Or even if I'm want to be provider and I'm looking for a job and they're interested in services from Legacy, then they should call the 956-467-5668 number, correct?
Yes, correct. Yes. And then they can also visit our website, legacyhhc.com. We have a list of um, open availability for positions as well, for the provider services.
Okay, that's perfect. I
Mhm.
was looking to see if it was listed on the little flyer, but it's not there.
Yes.
All right. So I know when I've referred patients for provider services in the past, one thing that
Mhm.
comes up quite often is uh, the what they say is I've heard that if I get provider services, that when I pass away, they can take away my house. If I'm a patient and I tell you, well, ma'am, okay, great, yay, I'm excited. I finally qualify for provider services, but I own my house. It's a humble house, nothing fancy, but I own my house, and I'm concerned that when I pass away, they're going to take away my house. What would your response be to the patients?
So that is a possibility. That would be the Medicaid estate recovery program. But there are some loopholes around that. So if the home is valued at less than $10,000, if there is a blind or disabled child that still resides in the home, if there is a living spouse still residing in the home as well, or if there is an adult child that is single and living in the home, then they cannot take the home away. So there's
Okay.
those little loopholes around it.
Okay. All right. So let's say that I'm in that position, but I have none of those things. I don't have any of that criteria. Then what can I do so that they don't take my home away?
Right. So that would be a transfer on death deed that they can look into. And our staff is also knowledgeable in that information, and can guide with those questions and that information on educating the client and the family members. But it is a transfer on death deed, which is a revocable legal document. It allows them to transfer property into a beneficiary's name, and it goes into effect once the individual passes. And it's filed at the county. It's a document that is, affordable, and it's notarized, filed with the county, and it's in place. So that is an option as well.
Okay, so where would we get this document from? Is it something that you guys have and you would hand out to the patient, or because you mentioned that it's notarized? So is
Mhm.
this something that you guys would give to the family member? I mean, to the patient or the family member to?
It's something that we can provide information on
Okay,
and where to get this document.
sure.
It's with the county, so our staff can guide individuals on that information.
Okay,
Mhm.
well that's good. At least there's some options there as to what can happen. I somehow had understood that it needed to go through an attorney, and I was like, well, that's going to be an arm and a leg. But if it's something that just needs to be filled out and a notary it can be done by a notary, then
Mhm.
that shouldn't be too
Yes,
pricey. That should be very reasonable.
yes, absolutely.
Yeah, I would definitely be interested in speaking to someone and maybe obtaining that form, because I know that this is something that I do hear from patients, and be able to like
Mhm.
hand them that form and be like, hey, this is something that you need to be prepared for. Start working
Right.
on this because this is something that you're going to need. So I'm definitely going to need to speak to whoever is knowledgeable in maybe providing either information on where I can obtain that form, or or has that form, so that I can have that on my person, because I can't tell you how often that comes up when I'm trying
Mhm.
to refer people into provider services, that's something that they seem to worry about.
Yes, absolutely. And I think that's so important to educate the community on that option as well. I know a lot of people have the idea that, oh, if I get provider services, they're going to take my home. So they are kind of scared, right? And it's unfortunate that they don't have that knowledge, or they're not informed, rather, on those
Sure.
options. Yeah.
Absolutely. I would hate for
Mhm.
someone to get, someone to, get some sort of benefits. I mean, it has to be an informed decision, and if there's a way that they, as long as they're aware of it and there's something that they can do to maintain their personal belongings, then I'm sure that they would probably want to do that. But if they have no idea that this is something that could possibly happen to them, then that
Mhm.
would not be the route to go. I'm sure they would be really thankful, be like, hey, this is something could happen, but let's get this form signed, go, and then we don't have to worry about any of this stuff. Then I think they would be
Right.
really appreciative of that.
Yes, absolutely. And I think a lot of people have a misunderstanding or maybe the wrong impression, and especially with the pause services, I like to go out and educate the community that to have a different mindset on home health, and particularly the
Sure.
pause services, because it is a resource. I like to say that it's a resource for the community. This program, it's a service that is here for individuals, and I really do like to emphasize on that. And it is a resource that is there for them if they qualify for it.
Absolutely, yes.
Mhm.
These are great things, and that's the reason why we're talking about this. And I have you here. One, I trust you completely with Legacy. As I mentioned, my mother is a patient that belongs to Legacy, and I refer to Legacy. But I think that patients and family members need to be aware of community resources, things that can benefit
Mhm.
themselves, make quality of life much better for them.
Right.
Small things like being able to have a cooked meal for them, their bed made, help with their physical appearance, makes such a big difference for people. And if they
Yes.
don't have this, then so I know a lot of people who just don't have the means of having someone to help them out with these small tasks that mean so much, and then end up in a
Right.
bad place. You don't brush your teeth. Poor oral hygiene has been linked to cardiac, long-term cardiac issues, so you'll end up with poor heart health and stuff. And most people wouldn't think, well, my teeth, if I don't brush my teeth, my heart could be bad. But the reality is that something so simple as, brushing your teeth and oral hygiene, can lead to poor heart health. So,
Right.
when people, if you physically can, you can have someone with Parkinson's and shakes a lot, or somebody who's had a stroke with a very, weak hand, can't raise that hand or use it. And so they're not physically able to do it. So they have a provider who comes in and can help them, brush their teeth and, take care of their hygiene issues. Then that makes a huge difference for them. Less risk of infection and better overall health. And just the sense of being, I mean, it's hard to keep your self-esteem up if
Right.
you're all the time your physical appearance is poor. And most people just want to be
Yes.
reclusive and hide from people. If they're physically, if they feel like, well, my breath smells, or my hair is unkept, it's got knots in it, or
Mm-hmm.
my outfit isn't at least clean or something. So
Absolutely. Yes.
so
And
these are great.
if you take care of yourself and you look good, you feel good, right? And
Absolutely.
what more if someone is there to assist with that? And it creates, it creates emotional, it affects emotionally, mentally, physically, and I think it enhances that once you have that assistance. It creates more of an independence for the individual as well.
I agree. I
Mhm.
agree. It's it's extremely rewarding. And not only for the person who's receiving the care, but for the person who's giving the care. I know I work healthcare, and when I change someone's life for the positive, it makes me feel so great. Like I wake up every morning thinking I'm going to change someone's life. If I can change at least one person's life, my day is it's worth it. I made a difference in someone's
Absolutely. Yes, absolutely. And a lot of these attendants answer the call to care, and it makes a difference in the clients or patients' lives to such an extent. And, really emphasizing on the impact that it makes on the patients and the possibility of, um, longevity of life that it also entails. It's wonderful. So it's very important, and um, we really care about our patients. And as I mentioned in the beginning, Legacy Home Health does put people first, and I think that shows with the assistance, and not just with the provider services. Staff does go beyond, providing outside resources if they need
life.
help with a food stamp application, or, other assistance in other organizations out in the community. We do have that information, and we will go beyond to provide that for
To
our
provide that.
patients. Mhm.
Ruben has a comment here. Ruben says on a social level as well, you know, and absolutely it has to do with, if you don't feel comfortable being yourself, then there's no way you're going to socialize with anyone. Like I mentioned, if your hair is unkept, your clothing isn't, it's mixed match, you feel like your breath smells or whatever, or your hair's in knots, then clearly you're not going to be in any place, any emotional place to be around people. And being reclusive doesn't necessarily work well for mental health. You have to be able to get out every now and then and see people, see different scenes. And no one really is going to want to do that if they just don't feel that their appearance is somewhat decent. So I definitely
Right.
agree with that, Ruben. Thank you for joining us tonight. But so the question is, are there certain restrictions as far as provider services? So let's say I'm a patient. What if my spouse wants to be my provider? What if my sister wants to be my provider? What if are there restrictions as to who can and cannot be my provider?
Yes. So as far as spouse, caseworkers would not approve of the spouse being the provider. Now it can be a family member, a friend, a neighbor, or if they don't have anyone, the agency can appoint a provider for them as well.
Okay.
But when it's all determined by the caseworker. I know a lot of people have the idea that the agency is the one that determines, but it is not. It is the caseworkers who um, approve or deny that. But it as far as the spouse, no, the spouse cannot qualify for being the attendant. Mhm.
And the rationale for this is simply because the whole point of providing a provider is for respite, right? To give them time for themselves.
Yes,
We're trying to
relief.
prevent burnout, right?
Yes, absolutely. And that's the point to the services is to relieve the caregiver. I know from personal experience with my grandmother, she did have services and she did have a provider, which would relieve my aunt who needed to go to work. Um, and it was very beneficial to my family um, you know, and she was able to go about some of the things in her life to take care of her husband as well. It is more so for relief of the caregiver. Mhm.
Which makes complete sense. We want, and plus we always want the spouse to be able to, if the spouse is likely, the spouse is always there with the patient the majority of the time. So when the provider is there, it allows the spouse to kind of step away those hours to do what he or she needs to do, even if it's just take a breather and sit
Mhm.
outside or whatever it be. Most people may go shopping or do their own personal thing because they
Right.
need to get away as well because they take care of the patient 24/7. I mean, let's be realistic. The provider is there, 2 to 4 hours a day, but the reality is care is 24/7.
Yes, absolutely. It is a lot. And, and not just for the adults, I want to also touch base on the PCS services for children.
Sure.
So for example, I'm gonna go based off of my personal experience as well. Um, my child, she had an illness when she was smaller. And so I was completely naive to PCS services. I wasn't aware that we could qualify for those services to relieve me as a caretaker to my child. And I find that so important for the community to be aware of because parents have burnouts, and it is so
Mhm.
important to have that provider there to help relieve or even to go to work for a little bit. Or whatever it is that the parent needs to do and collect themselves and have that relief so that when it is time to take care of their child again, they don't feel so overwhelmed. And it's the same for the adults, it's the exact same scenario. So both services, both programs are so important. And having that caregiver I mean, I'm sorry, the provider is such a relief to family members that are caregivers to their other family members as well. Mhm.
A huge relief. It's even if sometimes just an hour away, can clear your mind because burnout can lead to things like anger, resentment,
Correct.
frustration, nothing but negative emotions. And then what ends up happening is that the care that's being given to the individual, whether a child or adult, becomes inadequate because when something's not done with love and care, then it's not done well. And so we need to
Absolutely.
give the caregiver that time to, clear their mind, just be away a little bit, and then ultimately, come back. Okay, I'm back. I'm all in this again, and just be there. Because again, if not, then their anger. Why does this me? Why is this my child? Or why is this my mother with dementia? And just be angry, and blame people or blame God or whatever it may be, and just
Mhm.
make mistakes.
Right. And it all goes back to the burnout, not being relieved. And these services are, again, so important. They're just wonderful services, and I really do love and appreciate that there's these programs out there and educating the community that, especially I like to target more so right now the PCS services because there are so many parents that are not aware whether if their child is diagnosed with autism,
Yeah.
any kind of intellectual disability, mobility issues, and the list goes on. But having that relief and knowing that they can qualify for the services, is so important.
Yeah, those are really tough diagnoses. You know, I mean, I guess as adults, we tend to think, well, they're older. You kind of think, well, they're older. You kind of expect it. But with young kids, we kind of expect that they're going to be healthy, right? That they're not going to have health issues at an early age. But the reality is that's not so. We have
Right.
children that are born with certain illnesses, or they become involved in unfortunate events and then end up becoming in a place where now they're ill, and feeding tubes and trachs and all of these things. And so it's a really tough place. And it's a really difficult place for the parents and the siblings to be, to see their, the young ones to be in that place again, because you really don't, I guess our mind kind of isn't trained to see young ones or think that young ones would be ill. Illness kind of is
Mhm.
seen as something that's expected as we age versus something that happens when we're younger, if you
Right.
will.
Yes. And a lot of people get um, misinformed or have the wrong idea that it's just for adults, and it's not. There are PCS services for children as well.
I'll be honest. I mean, when you mentioned this, I was like, oh, I've always known that there was something for children, but since I work mostly with adults and healthy children, it's not something that I deal with. So I definitely need education in this particular area, which I'm so happy that you're here, because it gives us a reason why, it's again, not only educating the public, educating the providers as well. I do referrals, and so I need to know exactly what services are available, because if I don't know what's available, then I can't guide our patients appropriately. So
Right.
this is informative
Yeah,
for me too.
absolutely. And thank you so much for having us. Really appreciate, inviting us onto your show.
Of course. Of course, whatever I can do for our public, it's important to me to get this information out again, not only for the public, but clearly for myself too. It's a win-win situation. I want people on my show that I trust, and that way people can see, okay, these are people that we can trust. Because we're in an unfortunate time where there's so many scams. It's hard to trust, people. You see on the news where someone was injecting, claiming to be some sort of cosmetic dentist, and gluing, putting super glue in teeth, and or fake Botox and all of these crazy things. And so, I mean, I want to be in a place where I can provide positive, trustworthy resources to our community, so that
Right.
they feel like they have a place they can go to and say, okay, if I need this resource, I can come here. If I need this resource, I can come here, and just kind of build a little a little collage of to go, if you will, where they could just, if they need information on a specific, okay, I need home health, I'll go here. Okay, I need provider services, I'll go here. I need hospice, I'll go here. I need, and just be able to go. Doesn't mean that they have to choose those particular places, but if they have questions, they can start there and then make a decision of their own down the road. You
Right.
know,
And it's so important for businesses to have that information and guidance and of resources that, someone maybe they might not go to the Health and Human Services or call 211, but they're right
yes.
here in your office and they need this help right now. What can you provide me with? What information can you give me? And it's so important for businesses to have that information and guidance for the community.
Absolutely. Yeah. What I find so much is that people are really lost. They don't know where to go. And when they do go places, most times they seek information from family members that kind of really don't know what's going on. I've heard so many times, oh, no, 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 don't do this. Don't do that exam. It hurts. Oh, no, don't go here. Go there. And I know that the family members mean well, but when you get misinformation, then you don't always get good outcomes because it's not correct information.
Right. And I love that about Legacy is that our staff is well informed of outside resources and they have the patience to sit there and have a conversation with the client or family member and guide them and answer all their questions that they have, even if it doesn't pertain to provider services. Our staff is well informed and does have the patience to assist.
Absolutely. And that's the beauty about working with a program like yours, is that they have access to a social worker, you know. So more often than not, we live in an area that's somewhat underserved and has difficulty with resources. So you may go into a home, they don't have an air conditioner, their water heater went out, and the social workers are so great with community resource. Okay, you know what? This church is giving away this, or this area is giving away this, and so now all of a sudden the patient now has a new water heater, and a new air conditioner just because now they have access to a social worker who's able to get them community resources. And that's the
Right.
whole approach of the social worker. But they're not going to have access to a social worker if they're not in some sort of program, or in a place that has a social worker. And so that's the beauty of this program. You have a provider and you're like, hey, you speak to the nurse, hey, I'm having some issues at home. Can you set up a meeting with my social worker because I want to know if there's any community resources that can help me with X, Y, and Z.
Yes, absolutely.
So, it's
Yes.
kind of like a double and triple whammy. You get so many benefits, not only just the assistance with the activities of daily living, but, the assistance with, you know, assistance with things that you may need in the house that are vital. And air conditioning doesn't sound vital, but I do home visits and I've been in homes where there's no air conditioning, where there's ants or rodents in the home, and it's a really tough place to be for the patient. So
Right. Absolutely. I agree.
we have Ray, who was my co-host some time ago, and he's always welcome. He says, hi Sharon, great topic. Absolutely. This is Felicia. Meet Felicia. Ray.
Hi, Ray.
But yeah, so what else? Let me see what I have on my topic of goodies here. So we talked about insurance. We talked about provider services and the fact that you're hiring providers. That's really exciting, especially in a time where I know that people are, always looking for jobs and stuff. That's really important that you guys are hiring. And hey, $13 isn't bad, let me tell you.
Yes. And it's going up. So that's exciting. That's even more exciting and beneficial.
You can't beat a pay raise.
Right.
And we have Ginny here. She's one of our faithful listeners. She says, "Hi, Sharon. I completely forgot it's Wednesday." I was like, "Well, Ginny, it's better you than me. Otherwise, I wouldn't be here talking to Felicia. Then we have a real big problem. Then she'd be upset at me. So I'll forgive you this Wednesday. And I'm glad that you joined us anyhow." So Ginny says, "What are the requirements to become a provider?"
Great question. So the requirements are the agency does do a background check. So passing that background check is number one. Having a social ID um, and answering the call to care.
Sounds like you, Ginny. She would be a great candidate. She worked with us at Valley Baptist, and she's extremely familiar with patients, and she has a great heart. So I would highly, highly recommend her and give her my ultimate recommendation if that's something she's interested in, would definitely recommend her. She's
Awesome.
definitely
We'd
good
love
people.
to have her. We definitely love to have her. And if you are interested, you can reach out to 956-467-5668 and we can get you started.
Yeah, you came on a little bit late, Ginny, but this is the information. This is Legacy. My mother actually is a patient with Legacy, and I've referred multiple people to get jobs there, and they're extremely happy. So you're not going to have any issues with them. But this is, as Felicia just mentioned, their phone number is here, the 956-467-5668. Just tell them I sent you. They know me there, and let us know what you need. Happy to get you in there. Let me see. And Jenny says, "Thank you." Of course, there's no need to thank me. I'm only speaking the truth. And then Ray has a question here. He says, "I heard that family members can to hire you provide care for their family parents through the U.S. government. Is this true?" I'm a little bit confused about the wording. I heard that family members can hire you to provide care for their family members to the US government. Is this true? You know anything about
Mhm.
this?
Can
I heard
hire
that
you. What was the question?
he says, "I heard that family members can hire you to provide care for their family members through the US government. Is this true?"
I'm not sure about the entirety of that question, but you
Okay.
can hire family members. Family members can be the provider if that is what you're asking. It just
Yeah.
cannot be the spouse.
Yeah, I'm a bit confused about the wording too. Maybe he's asking what family members uh, can uh, uh, can um, can service providers, and I think we covered that. But he's probably came on late. So as you mentioned, anybody but the spouse, not the husband or not the wife of the patient.
Right.
Correct,
Mhm.
Felicia?
Yes, correct. Now, when it comes to PCS services for children, sometimes it can be the parent. It just depends on the caseworker and what the caseworker decides and approves.
Okay. And he's helping that question. She put members of the family helping their parents.
Yes,
So there can be family. Felicia saying that yes, she discussed that a
yes,
little while earlier today. So family members, yes, it can be like son, daughter, sister. So any family member except the spouse, like the wife or the husband. Correct, Felicia?
yes, correct.
Now Jenny is saying that she is interested. Do you have part-time openings?
We have several openings. So if you want to reach out to us at the phone number that was provided, the 956-467-5668, and give us a call, let us know what you're interested in, and we can go ahead and see if we have any clients that is something that with the same schedule that you're looking for, that we can match you with.
She's asking if she can go in person. She prefers in-person communication. Is there someone that she can go in and talk to in one of the office? Now I know she's out of Browns, like in the Brownsville area, and this is a McAllen, I think, number there. Can she go? Can she stop by the Brownsville office?
Yes, absolutely. She can visit us in office and we can assist her as well.
Okay, so she would just go for an application in the Brownsville location.
Yes.
Do you have the address for the Brownsville location? I
I
know they
don't
moved.
have, yes, they did move, but I don't have the information as far as the address for Brownsville. If she's interested in, she can give us a call. We can provide her with that address once she's ready.
I think I have it. I can look it up. I can give that to you, Jenny. Don't worry. Just message me and remind me. But I got you. I can take care of that. And then she says, I have tried to be my dad's provider, but have been told we can't live in the same house.
Right, that is accurate. Unfortunately, the caseworker, when they go out, they do a home assessment. They will ask questions as far as their diagnosis, limitations. If the provider resides in the home, um, they probably more than likely won't approve that person to be the provider.
Okay. Let me see. I'm just making sure I got all the questions here because a couple of them came in at the same time. Yeah, got everything there. All right. Those are all great questions. All right. Um, let's see. Give me
Now,
a
I
second.
do want to mention as far as the process of, as we spoke earlier about the Medicaid and applying for Medicaid, I do want to inform that it is a lengthy process. It can take some time. It ranges anywhere from 30 to 45 to even 65 days. It just depends on the caseload that the caseworkers have. And when I mentioned caseworkers, that's with the state.
The state,
So
yeah.
the amount of caseloads that they have will determine how fast they move with that process. But Legacy is big on communication, and we do follow up on the status of their application, and then we inform the clients or the family members of that status. So we do like to follow up with our clients and patients just to keep the communication going and reassure them that, we haven't forgotten about them and we're still working on, being that connection between the Medicaid and getting them the services that they need.
Yep. I think that's a good point to make. And I think the communication part is extremely important because when I've sent patients to other companies, patients have become quite, or family members have become quite angry when the provider services, they assume that provider services, okay, I see legacy today and provider services should start maybe at the latest a week or a few
Right.
days. And that doesn't happen. And then they realize,
Yeah.
wow, it's already 2 months and nothing has happened. And of course, it's out of your hands. It's a state thing, and they haven't heard anything. That doesn't make them very happy. So I know that you guys are great again because my mother's a patient. It took a while to come in, so I've been down this road. Just to say, hey, we haven't forgotten about you. I just checked up on the application, and it's still in process. We're still pending. But we haven't forgotten about you, and we're looking forward to working with you. And just a quick, easy to the point, and that's it. Because I guarantee you that if the provider services disappears off the face of earth, the patient's going to go somewhere else. I've seen it multiple
Right.
times without fail.
Yes, and our staff is very persistent when it comes to following up with the caseworkers insurances, and our staff members really do advocate for the patients on getting those services and pushing through, to reach that approval.
Jenny says, I appreciate your information. Thank you. And I will keep you in your mind. And Ray has another question. He says, what office are the social workers from? A private company or the county or the county or state? He wants to know where they're coming from. Like, are they local or are they from
The social
somewhere else?
workers or the
The social
caseworkers?
workers from the, well, I think they're
From like
caseworker.
the
Well,
caseworkers, as
the
far as with the
caseworkers from,
insurance, yes, and for determining the services approval, that's with the state. Social
but they're
worker,
local though, right? They're local with the, like the food stamp office. Are they coming from there?
yes, yes, they're local. Yes,
Mm.
yes. When they go out to do the home visit, the home assessment to make their determinations.
Yeah, and then the social workers, well, they're yours, right? You have a set of social workers with Legacy, correct?
Yes, Legacy does have a social worker.
Yeah, yeah. And they serve different purposes. So the caseworkers with the state are the ones that determine how many hours the patient gets. So it's not up to
Right,
Legacy. The state says, okay, this patient gets 30 hours. They convey that to Legacy, and then Legacy's in charge of finding the staff to provide those hours and managing that care.
right.
Um, but the state, but Legacy has no control over that. It's the state that determines the hours, if they qualify,
Mhm.
and all of that stuff. Again, it's a
Yes.
misconception that it's Legacy or the agency, but it's not. It's the state.
Yes, yes, it's the caseworker. So when they go out there, they do the home assessment, and based off of how the questions that they ask are answered, it goes on a point scale, and that will determine how many hours they get approved for, if they get approved, and what their tasks are.
Mhm. Yeah.
Hmm.
And the social workers, Ray, those are different. Those are the ones, that's the one with Legacy, and they're the ones who find community resources. Like example, if the patient's air conditioning is broke, then they'll try to locate one or get. Now they may not always be successful. I want to make that clear, because no one has unlimited resources, but they'll do whatever they can to try to get stuff. Or if they see that the patient qualifies for something like Meals on Wheels, just different community resources that they'll try to get the patient into resources, into different programs to help them live a better quality of life.
Right.
What else? We got about maybe 6 minutes left. We'll put up the Legacy information again, guys. um Again, remember, this is Felicia with Legacy. We talked about them looking for a few good providers at $13 an hour with a pending raise, and that's to be determined. They haven't mentioned what that raise is, because they're still in negotiations, but that will come out. But know that it's not going to be less than $13 an hour. So that's a job. I'm sorry. Oh, okay.
Oh no, I just kind of giggled.
Oh, okay. I got you. I got you. No, it's not going to be less than $13 an
Not
hour.
less than 13, no.
Not less than 13 for sure. So you can't go wrong with that. And the way if you're interested in either a job as a provider, or any questions regarding provider services, then you'd call the 956-467-5668. And then Ray says here, my mom is 89 and I know nada. You mean like she's not sick, or you mean that I'm confused? I hope it means that she's not sick. Or you mean that maybe you want some resources? See, because look, if even if you have no idea, if you think that maybe she needs some help, like there's a few things, like if she has like dizziness, issues with her eyesight, she has difficulty with her cutting her food or walking, getting around, she needs some help with activities. Even if there's a doubt, you can call this number, They can go evaluate her. The worst thing, what's the worst that can happen? No, she doesn't qualify for services, and that's it. There's no charge for them evaluating the patient. So
Right.
you can always have them go evaluate her, and if she doesn't qualify, well, you don't lose anything. But if she does
Absolutely.
qualify, then then you can get services for her.
Yes, definitely. The worst that can happen is to have a no response, right?
Mhm.
But um, trying to get those services is beneficial.
Yep. And they're really good. They'll help you with, okay, maybe she doesn't qualify for this service, because I know I've seen patients who go looking for one service, and I'm like, well, you don't fit in this service, but I see that you'd benefit from this service. And so, we're all, if we're in the healthcare business, we all should be advocating for patients and help placing them where they need to be. So let's say they're in one, looking for one program, and you realize this is not the best fit for them, but you think better fit somewhere else. Well, send them to where you think they'd fit, so that they can get some sort of benefit if there's somewhere you think they can go. So Ray says, I am new to this. She's fine. Now she has started using a walker. Again, it's no problem if it sounds like she's getting a little weaker from her lower extremities. Um, you know, Again, they can do an evaluation. What's the worst they can say? No, at this time she doesn't qualify. Let us come back, maybe depending on how they see her, 6 months later, and see how she looks then. Or something changes, then you can call them back then.
Yes, absolutely. Yeah. Ray, give us a call and we can, have a conversation and assist you and guiding you in services for your mom. And we have staff that are very informative, and we'd love to help you and your mom to get qualified for those services.
Absolutely. Yeah. Like I said, I know you came on later, Ray, but my mother's a patient of theirs, and she's extremely happy. And I refer to them. That's who I use, because my mother's. If my mother's happy, then I'm happy. So, all right, guys, we got. Excuse me. We got a last few minutes here, so we'll wrap it up with whatever last comments or questions you have. Again, if you have any particular topics or services that you're interested in me discussing, I'm happy to do so. I'm here to cater to our public. If you own a small business, or a small business that provides medical services, and you think that they would be beneficial to our community and sharing whatever information they have, then I'd love to speak to them and see if we can, have showcase them at one point in time. Today we had Legacy with Felicia, and they're looking for people who are interested in working as a provider. In order to be a provider, you must be caring and compassionate and have a heart, and like $13 plus. And or if you're looking for provider services, period, or just have a doubt, question, let them go evaluate you at 956-467-5668. You have any last words for our viewers, Felicia?
Just keep in mind that, these services are resources for the community, whether it's an adult or a child. Give us a call and we can definitely help you, guide you, see if you qualify. Um, we're here for you, and anything you need, give us a call, 956-467-5668.
Alrighty, thank you guys. Good night, and we'll see you next Wednesday.
Thank you. Have a good evening.
Bye bye.
Bye.